So as Melissa said, I'm Emily Weinstein, and for most of my career, I've worked in affordable housing and community development, large-scale redevelopment efforts, mostly throughout California. For nearly 8 of those years, I worked for Bridge Housing Corporation on the redevelopment of a public housing site in San Francisco that we call Rebuild Potrero. And it was there that I, along with the community members, as well as San Francisco State Health Equity Institute, created a new approach to community engagement, the model that we'll be talking about today, called Trauma-Informed Community Building, or TICB for short, since we all love an acronym. But the TICB model really emerged for 2 reasons. One, it was in response to the community needs for community building on the ground. And the second was, it was in response to the very real frustrations that I was feeling about the expectations of what the project was supposed to achieve and the realities of the situation on the ground. So Rebuild Potrero is one of 4 what are called Hope SF sites. It's a San Francisco city-led initiative to transform some of the most distressed public housing sites into mixed-income communities without displacing existing residents and adding new infrastructure, parks, open spaces, programs and services, community centers. It's really a holistic approach. Potrero itself is a 600-unit public housing development. It's actually made up of 2 different public housing sites in the southeast area of San Francisco. And it was built originally as temporary workforce housing during World War II. Now the housing is crumbling. The infrastructure is not functional. And the average household income when we started the project was around $12,000, $14,000 for a family, and that includes community benefits. Full-time employment at the time was around 15%, and only about 1/3 of the 3- and 4-year-olds were enrolled in any sort of formal preschool, even though there was a preschool on site. One of the other challenges about Potrero is that it's a unique neighborhood in that it's a concentrated pocket of poverty surrounded by multi-million-dollar homes. And when I say multi-million-dollar homes, it's in one of the nicest areas of San Francisco. It's multi-million-dollar homes, just steps away from the public housing. The stark difference between the socioeconomic levels and the lack of infrastructure and resources on one slope of the hill reinforces a level of isolation and disconnection from the rest of the city. It was under this environment that Hope SF was launched. And across the country, and many of you are involved in efforts, large-scale community development efforts like Rebuild Potrero are focused on providing affordable housing, mixed-income housing, supported with programs and services and community building strategies. And the goal is intended to deconcentrate poverty and increase outcomes for residents, including educational attainment, economic security, social mobility, stable housing, good health, socioeconomic integration, all of the long-term outcomes that we've been discussing over the last few days. But so often, we see community development efforts succeed in improving the built environment, but falling short of some of the community building and the socioeconomic goals that they're aimed to achieve. The TICB model recognized that for some communities, community trauma hampers participation in traditional community building and limits the impacts of broader community development efforts. The TICB approach assumes that communities can't just change no matter how much money or resources you throw at them. Community development and the participation in traditional community building requires a readiness for change, a set of common experiences and neighborhood conditions that sets the foundation for change. Here in this slide is the beginning of a theory of change. One of the things I learned by working with public health practitioners is they love a theory of change. As we talk about the TICB model, we'll really be walking through this theory of change and adding to it to show how the TICB approach is designed. In this theory of change, you see that the tree represents community development. And the long-term outcomes, the leaves, of all of the outcomes that we are aiming to achieve have to sit on the base of the community development efforts that are underway. But I would argue that it's not just about growing a tree. It's not just about the community development, that the community development has to have its roots in healthy soil in order to grow and prosper. For many years, when I presented on the TICB model, there was a lot of confusion. Foundations, practitioners, government officials all wanted the TICB model to be a positive example of change that could be measured and would result in the long-term outcomes. But it's not. Sorry to disappoint. It's a model to help create the foundation for change, not the actual change itself. And that's something we'll reinforce over and over today. The TICB model explores the questions of what conditions need to be in place to prepare for community change. What does a community need to sustain long-term community development? In other words, what are the indicators? How do we know that we have healthy soil? We often go into community development work thinking that we are community-based or rooted in the community with an asset-based approach to community building. So we believe in the active participation of residents in the process of strengthening community networks, of programs and institutions. We leverage strategies around strengthening social networks, engaging residents in the planning and the vision setting for the neighborhood. We leverage the community assets to solve the collective problems in the neighborhood. And we collaborate with the systems and the institutions in the community. And that all sounds really good. But I want to talk about the reality of what it was like to do community building and to go into the community with that approach in Potrero. And much of this will sound familiar to many of you who are working in your communities. No matter how much outreach we did, there was low turnout at meetings and at community building events. That when people did show up, it was often the same people showing up, and that there were only a few powerful leaders that were representing the voices of a much larger community. When we went to approach program and service providers and other potential partners, there was a lot of infighting and turf wars between service providers. And it was all based on just an environment of distrust. It became very clear, very quickly, that traditional community building strategies were not going to get us to the long-term outcomes, the desired outcomes that we had for our community development efforts. We needed something new, and most importantly, we needed to address the realities on the ground. Here in the model, what it shows is that beyond the roots of the healthy soil, where we would like to go, the foundation for change, many of our communities have roots that are in unhealthy soil, impacted soil. What we came to understand is the realities of community trauma. Community-informed services and systems has become ubiquitous in the field. However, trauma-informed community building or trauma-informed community development is not. When we talk about trauma, there are really two levels of trauma. And I am not a public health official, and so I've had to kind of learn the differences, and they're often confused. But there's really individual trauma, which, according to the National Center for PTSD, is a set of normal human responses to stressful and threatening experiences, such as an accident or a death of a close family member. Community trauma, on the other hand, is chronic, pervasive, and cumulative. The Family Informed Trauma Treatment Center says that families living in urban poverty often encounter multiple traumas over many years. The stress of limited and ineffective services, chronic poverty, crime, and untreated physical and mental health issues reduces resiliency, hinders community cohesion, and leaves residents in survival mode. So what are the impacts of community trauma, and how does it impact traditional community building and community development strategies? The conditions of trauma that impact community building are vast. Many of them include the breadth and depth of personal and community needs, the historical community disinvestment, disempowerment and a lack of community ownership, as we mentioned, distrust and disconnection. There's a constant kind of environment of instability, unreliability, and inconsistency. Residents are treated as service consumers rather than partners in creating change, and a difficulty envisioning the future and positive changes. Now, I want to be clear that I'm not blaming the community for these conditions. This is a natural reaction to systems and institutions failing to meet the needs of communities and the results of institutional racism, isolation, and lack of resources. But given that this is the reality for many low-income communities, what now? How do we go from impacted soil to healthy soil? How do we create the conditions for change in trauma-impacted communities? The TICB model aims to do just that. It is the layer of soil, the soil improvement, or I like to say the fertilizer, the shitty hard work that needs to take place to go and create the healthy soil. TICB is a model of community engagement and an approach that honors residents' past experiences, prepares residents and other stakeholders for change, and shapes the institutional infrastructure necessary to sustain long-term community improvements. The goals are to de-escalate chaos and stress, to build social cohesion, and to foster community resiliency. The model itself, and unfortunately we don't have time to go into all of the details of the model, but from a broad brushstroke kind of level, the model itself is made up of 4 underlying principles and intentional strategies at the 4 levels of what public health called the ecological model. So strategies at the individual level, interpersonal level, community level, and systems level. And it can start with something as easy and simple as a walking club. Many people look at a walking club and think of a health program. And sometimes a walking club is just that. In Potrero, the walking club was a community building tool, an ongoing process to bring people together, to build relationships, to provide opportunities for healthy, positive interactions, and to develop consistent interactions between residents, the developer, and other community members. What's also interesting is that over time, the walking club became a way for outsiders to get to know residents and experience the community through their eyes and on their terms, and for residents to get to know outside institutions. For example, foundations. Foundations often come in and they want to do a tour of a neighborhood. Well, in Potrero, where there now is a walking club 3 times a week, the response to a foundation that wanted to see the neighborhood is, great, you can come on the walking club, it's 3 times a week, which one of these times do you want to participate in? The difference in the dynamic that creates on site and the change in the relationship and the importance of the resident's experience in that interaction was huge. It opened doors for residents to build relationships with foundations, and it also gave foundations a much better understanding of the realities of residents' experiences. The walking club has also over time become a vehicle for the neighborhood PTA. Many of the leadership in the neighborhood school had never set foot into public housing. So the walking club has become a safe space where PTA members, outside residents, can come, have a shared experience with residents, and feel comfortable in a public housing setting. All of these are intentional strategies in the TICB model. And unfortunately, we can't get into them. There are many. This is sort of a graphic of the model. There's copies of the paper, a white paper in the back, that goes into all of the individual strategies and their importance. But I just want to make kind of it clear that, again, these strategies that are intentional. It takes a lot of hard work to stick to the strategies, to constantly reinforce the underlying principles, and really to make sure that you're honoring the community trauma and not re-triggering residents as you're going about doing the community building, what sometimes seem like very simple activities. When we first came out with the TICB model, people always asked, how do you know it's working? How do you measure success? So the model has evolved over time to have clearer outcomes, and it now includes an evaluation framework. Really what we came to understand is that our impact should be the inverse of the conditions of trauma. So when we talk about what a community looks like when it is ready for change, Instead of instability and inconsistency, it should be a reliable and stable environment. Instead of an environment of distrust, it should be an environment of trust. Measuring the readiness for change then really is about looking at this spectrum where you're looking at the conditions of trauma and measuring the movement to what we're calling indicators of community strengths. So now I want to bring it, I know that the kind of presenting the model was sort of a little bit of a teaser, especially not being able to dive deep into the model. But what I want to do is bring it back to Jody and Ryan here on stage to talk about their work in their communities and how the model resonates or doesn't resonate with your work, and also to learn more about the work that you're doing on the ground. So I'm going to now, I guess, sit down, and we'll have more of a conversation about the model. So I'll open it up. Oops. I'll open it up to Ryan first. Why don't you introduce yourself, talk a little bit about the community you work in, and kind of your initial thoughts on the model.
Absolutely. So everyone, hello. My name is Ryan, Purpose-Built. Thank you so much for having me here. Emily, thank you so much for having us join, although you didn't know me, so maybe it's an apology, really, but thank you so much. My name is Ryan. I'm from Houston, Texas. I work for an organization, Connect Community, that's a purpose-built community that works in Southwest Houston, in a place called Gulfton. Our neighborhood is 5 times more dense than any other neighborhood in Houston. I think the stat is we have 19 or 18 schools in a 2-mile radius. I mean, we are on top of each other, and our students and our parents and our families are all working within that space. That is my larger ecosystem of community, but I run a middle school project. So my more local community, the hallways that I'm in every single day, is a KIPP middle school in Houston, Texas, that services 440 kids and their parents. And I run a project based on social-emotional learning. Social-emotional learning is based on the competencies of becoming aware of your own story and then pushing kids to be aware of other people's story. Our project at its core is about connecting people, connecting students and teachers, parents and teachers, and really connecting humans. And so, Emily, your model truly connects. You said it first, but there is a shit ton of work that we must do. And that was your word first. And so, there is so much work that needs to get done, and there is so much stuff that has been done before, way generationally, again and again and again, that we must get through on a daily basis. And I'm certainly from the world of, it is so easy to program, to have a parent night, to have all these things, but if you're not willing to do the real work, then it's not enough. And so I am here representing our community, I'm here representing our kids and our families, and that's the work that I live in every single day.
Okay. My name is Jody. I work for a nonprofit in Atlanta, Georgia. It's called Chris 180, and we have a lot of different services. We have mainly a lot of different counseling centers and a school-based counseling program. And we have 23 different schools in Metro Atlanta, 4 of which are with Purpose-Built Atlanta schools. And we initially came in with them 3 years ago with the understanding that we were going to be their behavioral health partner, and we were going to come in and provide counseling services to students at the school to eliminate barriers to treatment. A lot of families in these communities aren't able to get to a main counseling center because of transportation or the parents' work schedule. So that was really the initial goal, was let's just eliminate barriers to treatment. We'll send clinicians into the schools, and that will be fantastic. The model resonates a lot with me because that was not our experience. We learned very quickly that that wasn't enough to scratch the surface, and it was great to bring these services in, but if you can't even get the parent on the phone or get them to come in for an assessment, you can't offer these services. So we learned very quickly we needed to zoom out and create a different model, still having the clinical services on site because there were a lot of families who were ready for that, but also zooming back out and really thinking about building relationships, addressing what wasn't said at the beginning, which is that there's still a lot of stigma associated with counseling. We will not let our clinicians say mental health because that will get the dial tone really quickly. So our services have now kind of morphed into a much more comprehensive school-based counseling approach, which is that They will provide services to students on a caseload, individual therapy, group counseling, family therapy, but we also are focused on the school as a whole and the wellness of the teachers. So we have developed a trauma-informed care training for the staff, and we have adapted the ARC model, which stands for Attachment Regulation and Competency, which is a framework that you use for treating complex trauma with children, adolescents, and families. And we've taken that and modified it to work with teachers because they are caregivers. And for a long time, we didn't think of them that way, but for many of our students, they are with their teacher more than a parent. So we've done a lot of work with the teachers on developing their own skill set and competency in these areas in terms of being attuned to your students, relational connection, caregiver affect management. How am I checking myself a little bit before I come into the classroom? And that's just, we developed it because we saw it ourselves, we saw the need, and we also heard directly from teachers. I went to school to be a teacher. I cannot teach. I was not trained how to do this. I don't know what to do when 6 kids in my classroom are fighting. Somebody's coming at me with scissors. Somebody's running out the door. And it's not their fault, but that's not how their training has prepared them. It's prepared them to teach. So I'll leave it at that.
Great. Mm-hmm. So thinking about the model, one of the main goal is this readiness for change. So kind of putting the trauma aside for a moment and thinking about like the dream of getting the community to a place where it is ready for change. What would that look like? What would that look like in your community? How would you know it was ready for change?
Yeah, I think.
Wait, I can go first. I asked you, do you want me to go first? Do you want to go first?
That's okay. Yeah, I got it.
Let's make sure.
Thanks, Ryan. I think one indicator is consistency, which you talked about. It's one of the main components of the ARC framework is consistency with daily routines and rituals. So if there is a meeting that we as the stakeholders are showing up, and not showing up once a quarter to just touch base and leave 5 minutes in, but showing up in a meaningful way, in a very intentional way, very consistently, and not having Ryan go 1 month and then I'm there and then you're there, but the same faces every time. And I think with the residents, that's a huge indicator of change. If they're coming because they want to be there and not because they were bribed with the idea of free food and they're coming for the food and leaving, but because they want to be there. And I think with that, which is a conversation we have a lot with our families, is a major indicator is hope, which is something that we don't always talk about, but it's this underlying theme with a lot of our families, and it's easy for us to blame a parent who doesn't show up and say that they don't care about their child, they're being irresponsible. But if you sit with them, you will hear a narrative that very much explains their behavior. Why should I show up, Ryan? Nobody's, you're not gonna be here in 6 months. You promised me this before. We've heard things like this, Emily. So an indicator of that change and the readiness for change is that people are coming to the table because they're hopeful that maybe this time this will happen. Maybe my voice is meaningful. Maybe if I say something, somebody will listen.
I agree. It is so much about bringing people to the table. But before we get into that, I wanted to quickly address what it's not, what readiness really isn't. I come from a school background. So what readiness isn't is just showing up. What readiness isn't is just providing minority kids with blazers and boat shoes and hoping that they'll make everything work. What readiness is having a group of people at a table who are really ready and willing to meaningfully discuss real issues about real systems and actively change them. And unless you have those people and funders and a whole lot of love all in one place, it's simply not going to work. And it's not going to work if we continue to just try with our best intentions and our best system analyst views of how to change things if we aren't willing to really come to the table and address some very, very real issues. So it takes fighters. I was talking to my mom the other day, and I was feeling really down in our work. Our work is very real. And I talked to I shouldn't have said that, right? I talked to a person. It was really my mom, though. I call my mom on the way home. That's true. And it's just like constant work again and again and again. It's constant fires again and again and again. And I realized that I wanted to grow up to be a fighter so much. I went to law school for a year, it didn't work out, so I had to pick a new fight. And I so much want to be a fighter, and I thought I was fighting. But I was in a fight, but I wasn't fighting. And I took that weekend, and I thought about that. And so how I'm bringing it back to this conversation is we have to have fighters at the table. Not just people who are showing up to a fight with boat shoes and blazers. And I love boat shoes and blazers. I own many of them. I'm just saying, it's not enough. We have to have people who are really, really ready to engage in a very true fight for our communities.
And I would just add one more piece to that, which is, you're right, showing up in a meaningful way.
Right.
And another core component of trauma-informed care is curiosity, right? Being willing to open your mind and be curious about what might this be, and what might
this be?
Right. And I don't know if he's in here, but the CEO of Purpose-Built Schools Atlanta, if you are in here, I can't see you, but he was that person who sat with us and said, what can we do? What can we do differently? We initially brought you in for counseling. We need you to do much more. And now we have multiple clinicians and multiple community support individuals in their school, and they're doing much more beyond what we initially thought. They're really working in system change, which they're not trained for either. But I think that's a piece of it that we forget too, is slowing down enough to be very curious about what might be going on.
Absolutely.
So along the same lines, can you expand about how community trauma then shows up in your work?
How much time do we have?
We have 30
in a lot of ways. I think it's easy for us to talk about how it shows up in the kids in schools. These are conversations we have daily. Because it's misunderstood. But the way it presents is, you won't be surprised to hear, it presents with the kids who are defiant and the kids who are very irritable, and you touch them just briefly in the hallway and they're punching someone in the face. It shows up in students that are sleeping in class because they can't sleep at night, or who just are all over the place, really, really impulsive, jumping around from thing to thing, not learning, not sitting still and focusing. Again, I say it's misunderstood because we will often get, I'm speaking for us,
no,
but
please.
We will often get referrals to address all of these children with ADHD and all of these kids who are incredibly defiant, which it looks like on the surface, but if you look through a trauma lens, their behavior makes sense. It's a normal response to what they're going through. If I am frequently in that fight, flight, freeze state and somebody brushes by me, I'm not going to wait to see what happens. I'm going to react. Similarly, in teachers, this is where we're seeing a lot of the trauma show up in a way that I don't think people wanted to recognize for a while, but it's showing up in them in similar but different ways. We're seeing, and I will just say this, I'm not blaming teachers at all. We love teachers, and that's why we're in the schools. We're trying to support them. But it's coming out in, again, ways that make sense. Teachers are often being reactive to what they're seeing. They're not staying in a rational, calm state of mind because they're heightened at all times, not knowing, is he gonna throw something? Is she going to attack this other student again? Is that parent gonna threaten me in the parking lot? So they're up here at all times. There's no way that we can expect them to be calm and reasonable and be able to teach, right? So it's showing up in that way. It's also showing up just in their own physical wellness. A lot of teachers calling out, being hospitalized, or eventually possibly quitting before the end of the year. We've had a lot of these things come up in our small group work with teachers where they're really feeling safe enough to share that they might get to school and sit in their car for 20 minutes because they feel physically sick. They're a little paralyzed and cannot they're not ready to even walk in the building because they feel ill. Or those that have also felt safe enough to say, I drink pretty much every night. So it's showing up in those ways. And I think the administrators at the school have a tough time because they're not only experiencing their own secondary traumatic stress, dealing with that, but they're holding it. They're holding it for their staff, they're holding it for their students and the parents that they're connected to. So in similar ways, it's seeping out of them. Sometimes even with the best of intentions, they're making decisions based on raw emotion and fear and survival, not based on calm, rational ideas that they went into the school year with. And then lastly, I think with the parents, it's showing up in every part of it. Some schools, you can't get the parents in, and that's not saying the parent does not care about their child. They don't necessarily, first of all, if their basic needs aren't met and there's mold in their house and their door's been broken for 6 weeks and the landlord hasn't addressed it, it's unfair of us as providers to expect them to be able to come in. And if they come in and they're distracted, doesn't that make sense? So we're seeing it everywhere. And even on the clinical side of things, we're very much seeing it in our own staff who are trained to do this. They're also having a hard time holding that and knowing that the way that we're going to see change is patience and understanding and empathy, which is going to take years.
Yeah, I couldn't agree more. I mean, and it goes back to that community stress of teachers being underpaid, being told at every single PD that they're superheroes and they can do it all, when the reality is they can't do it all. And we have to support them. Our project provides counseling, individual counseling sessions for 50% of our school staff for them to process their own trauma, because we do see it in so many places. How I connect to the question about trauma, and we do need a lot of time for this, 2 things come to mind. One is on Tuesday, before I left my flight on Wednesday, I had a parent conference with a girl who was new to our school, and first report cards were released, and she had a 50, 50, a 53, and another 50. And in reality, the lowest grade you can get at the school is a 50. And we actually looked at her grades. It was actually 33, 41, 27. I mean, those were her grades. Mom came in, who's a part of our project. She cannot control her daughter anymore, is very worried about her daughter. And we were just there at that parent meeting. And it finally came out from the mother's point of view after I asked, what do you have to say? Like, what are some of your thoughts? And mother began sharing how her father walked out at 4 years old, and how the mother didn't have a father, and the girl just burst out into tears. And I shared that story not because it's the first time I heard it. I shared that story because time and time and time and time again, we have victims of victims of victims of victims who are in our systems, who are in our school systems, who are just trying to make it work. And like Jody is saying, some of our kids are experiencing so many different things, and they come to a school and a teacher gets mad at them for not having their pencil or not putting the heading on the paper. And yes, there are so many well-intentioned teachers. They are wonderful. They need to make more money. But we really have to get real about what our kids are experiencing and what our adults are experiencing. Another trauma that comes to mind, community-based, is we work in a high immigrant population, and there's a mother, a person, a lady who is absolutely wonderful and is a fireball, and we all love her at Connect. And I know that she walks around with a letter in her purse because she's undocumented of what to do with her children if she's picked up. And she, like the mother and daughter that I had a parent conference with, is not alone in her struggle. Trauma is everywhere. And that's just the case.
Mm-hmm. So, how do we go from the unhealthy soil, the impacted soil, to healthy soil? What are the strategies? What are the ways that we can work in the communities and work to prepare them for the change so they can be successful with the change?
Absolutely.
Yeah, I think something we tell our clinicians all the time is something they are supposed to learn day one in graduate school, which is you start where the client is. And it's easy to see that on an individual level if you're working in outpatient therapy and they come to your office, but I think it's it's much harder to hold that when you're working with a system where the school teachers are your clients, the children, the parents, the community as a whole. But it's a really basic principle that if you don't follow, you've got nothing. And when we say start where the client's at, that's what we mean. If the parent says, I don't want to come in, and we force them to come in, we are re-traumatizing them, and we're not empowering them to make a decision and to decide that I want to come in because it's my choice and I have the ability to make a choice. So if they say I don't want to come in or I don't want my child in services, we're going to respect that. That doesn't mean we've given up on them and we're going to move on down the list. We're going to loop back in a way that's comfortable for them. If that means they say, it's okay, you can call me again in a month, we'll call them again in a month. Maybe at that point they're ready to come in and just talk, then that's what we'll do. But I think we often feel the pressure to put all of these different programs in place, like you started to talk about. Let's do an anger management group, and let's do a parent workshop, and all of these things which just cause fatigue for the families, fatigue for the administrators. But again, we're not starting with the basic level of building trust, building relationship, understanding where they're coming from, giving them a way to get involved in a meaningful way. So I think that just has to be the core. And then certainly all the themes that we talked about in terms of consistency and bringing their voice and choice has to be a huge part of it, empowering them to have a seat at the table.
Absolutely. Emily, the question is, how do we get the work done, right?
Yeah.
Like I said earlier, I truly believe it's about getting people, it's about getting adults together to really discuss real issues. There was probably someone in here that was offended by a comment that I made about blazers and boat shoes. And it takes you to be challenged and you to accept that challenge. And for you to show up and be willing to be offended and to get in there time and time again to do the real work. Just because you're a school leader doesn't make you a school leader. Just because you're a teacher doesn't make you a teacher. Just because you're a director of a social-emotional learning program doesn't make you a director. You really have to be willing to ask yourself tough questions, to challenge yourself. And I think once you get those people in the room, and that's all of us, you know, the purpose-built model that we live every single day is engaging those partners to come together, leveraging your resources. We need money, right, to make it happen. And like I opened with, it truly is about modeling love and communication to our families and our parents and our community. And we spoke about this yesterday briefly. I, in a lot of cases, feel like we're building Trojan horses. We get money sometimes and we're asked to do things, and we do those things, and I'm so grateful for those resources, but it doesn't always fit the larger problems or the deeper problems. So I feel like in a lot of ways we have to build these Trojan horses, these mini Trojan horses and these large Trojan horses to really develop and really innovate about how to address those problems. But to answer your question pointedly, it's about people, and it's about love, and it's about coming together.
So just to follow up on that, you mentioned yesterday that a lot of the funding you get is to improve grades.
Mm-hmm.
So given that improving grades, those are the long-term outcomes.
Right.
What do you do? What are some of the strategies so that the community is prepared to eventually get better grades?
Yeah, so what I didn't share in the story earlier was, it wasn't just me at that parent conference. There was another teacher, actually an AP, who was leading that conversation, who was a former teacher, and she was a partner teacher in our SEL project. And what we ask all partner teachers to do is to model vulnerability in their classrooms by exploring their story in front of their kids. And in that, inviting their kids to explore their own story. And so at the end of that parent meeting, that teacher, that AP, was able to reach across that table and share with the girl that she too was not raised with a father. And so it's about that vulnerability. It's about action. I'm not Brene Brown, although she's wonderful, but she would agree with us, right? It's about daring greatly, and it's about really using that vulnerability, that real vulnerability, to really accept that challenge and really being able to engage Because time and time again, we've seen people who would have let that girl just cry and they would have consoled her and felt bad for her, sure. But it's really about connecting people. So that's why I would say that's how we ultimately improve grades, right? We improve grades by building better humans, by helping humans. And next time when she picks up that pencil, she will do a better job piece by piece and will be there every step of the way to help support her and her mom.
That's great. I think one of the challenges that we always have is that the foundations, the money, they want to measure the ultimate outcome.
Right.
Right? So how do we then start to have these indicators of change that can be measured and that is, setting that foundation for the long-term change, but getting people to understand that it's going to have this incremental step, and that if we really want to respond and heal communities and address community trauma, then there has to be a way of really understanding what's happening. So I want to, I know that there are people in the audience who have questions. So I want to open up, there's very bright lights out here, so I can't see anything. There
are a few people here, though. I can see these people here.
Out there with mics, hands being raised. I just don't know what time it is. Any questions?
Thank you for asking the question. Thank you, ma'am. Appreciate you.
You're welcome.
Thank you.
So, do you track the academic success of the students that you work with? I know you were mentioning that a little bit toward the end, but I'm just wondering if there is a systematic number of times that you address the students' needs, and then how do you determine whether it's working or not?
Right. So yeah, I think tracking is really boring, and that's why I didn't bring it up, but funders love that, and so I definitely have an answer for you, which is we look at data daily, weekly, monthly, and obviously yearly. So yes, we track all of that. We track their grades, and a story that I can share from last year is we had this student in class, normal story for us, right? Father is not very present, had to really lean in for him to work with teachers to make sure that they understood him. And by the end of the year, and you can see this on a graph that I don't have with me, exponential growth in that partner teacher's classroom, doubling his ACT, doubling his trajectory for colleges. I mean, the numbers are there. It is slow though, and if you're not willing to listen, you have to be willing to listen to that small growth, those steps by steps. But yes, we do track their grades, and also our school's aligned to PBIS, and so we have an internal behavior tracking system. And my projects run on what's called CASTLE. And so we've aligned each one of those behavior entries. So the internal tracking system both encourages and discourages certain student behaviors. We've aligned all of those to CASTLE competencies, and we can track every single kid in our program, how well they're growing on self-awareness and how much work we have to do on a daily basis.
Can you also share how, besides maybe the social workers and counselors, is the school a part of measuring the socio-emotional learning and outcomes and impact?
The answer is, I don't know. And that's a national conversation we need to be having. You have a program, do you have an answer to that? I don't have an answer to that. I mean.
No, I think.
But that's the answer.
Right.
The answer is that we are missing a huge chunk in education because we are only focused on academics. When we talk about that our kids are doing better, we are not actually talking about that they are better humans. We're not actually talking about the girl has someone to talk to about her trauma. What we're actually talking about is that they scored, instead of a 50, they scored an 80 on their state exam. But in reality, if you really look at states, it's really actually a 40 or a 50 to actually pass that test. So that's what it means when kids are doing better. So to answer your question, we need to be doing more. I have no idea how school districts track social emotional learning or any indicators, because it's a pretty new conversation and people in our system is just focused on grades. And yeah, I think that's the answer.
Hi. In my discussions with a lot of community folks that we deal with, that violence is normal. And it's become so normal that they're desensitized to it. And so trying to get people to be vulnerable and tell their story sometimes seems to be very difficult because they don't see it as something out of the ordinary. So when you do find people that get it and understand it, how do you build capacity for those people to go take that out to the community and teach and build capacity so that it's systemic change as opposed to
One-off.
individual?
Mhm.
Yeah.
Absolutely. So that teacher that I spoke to earlier who reached across that table to talk to that girl, she was so reluctant to be a part of the program. Was, as Jody mentioned, it's taboo to talk about our stories. Nobody wants to talk about how they feel when their dad walked out. Right? I don't want to share my story all the time. And that teacher was so reluctant, and after a lot of using your model, Emily, a lot of that groundwork to really ready not only her, but a team of teachers at that school, we were able to work in one classroom per grade level that reaches all 440 of those kids to really grow them, encourage them, and really support them in the dissemination of the information. And I will also share with you, there was a teacher at our school, a former teacher at our school, who has now taken those lessons and taken those understandings to her new school in Arkansas. So it's a slow burn, but it's a mighty burn, I would say. It takes a lot of that groundwork and a lot of time cultivating that soil to make sure that people are really willing to engage in those stories. And also, as you mentioned, working with our students to be accepting of those stories. And really the goal of our projects is help cultivate those stories within our kids. So it's a lot of work, but it can be done.
And I would just add to that, you mentioned vulnerability. This is something we work with our school administrators on in particular, because the teachers will often share that I have my own trauma history, that doesn't excuse their behavior, or parents are unlikely to come in and want to share some of the traumas that their child has experienced, because the concern is you're going to take my child away, you're going to report us to DFACS. But what we work with the administrators on is demonstrating vulnerability with their staff and their students. And we recently had a principal who was being really reactive to a student. She was actually trying to de-escalate herself in his presence and talk to him about what was bothering her. And he stayed up here because he was really in his own feelings about her disrespecting him. But when we were able to pull him out of that and have a one-on-one with him, he was able to recognize why he was so triggered. And when he came back down, he demonstrated vulnerability to her, and he was able to actually write her a letter about what was coming up for him and why he was so emotionally reactive, so that she could see through his own modeling that it's okay to talk about some of these things. So it was really beautifully done on his part, but it started in a pretty ugly place, and he just needed to be willing to go there as the leader of the school, which I think was a great example for his staff.
And it takes systematic change, right? So that's not only that school leader, it's that regional director, it's that superintendent, all buying into this model. And it's people like myself who are so nose down in the work, doing a better job of communicating the meaningful and data behind our work. So it's both of us coming together to work together to really create that change.
I would say also an example from a community building example in Potrero, where you have this real divide of different incomes. We had to be very intentional about creating opportunities for shared experiences across the economic spectrum. And so we would have regular, what we called Unite Potrero events. And it took a lot of time before people began showing up, but it was creating opportunities. One of the events was called Unite Potrero, a community-wide walk. And all it was sort of taking some of the tenets of the walking club and doing it across the entire neighborhood, across both the south and the north side, and having an opportunity for Southsiders to experience the north side and Northsiders to experience the south side, and doing that walk together, and then having points along the walk for sharing out. Not everybody shared out, but you were starting to have moments where people could connect, and in that same process, creating now what had become a shared experience. And so we constantly kind of do intentional activities like that to create opportunities for some of those shared experiences, but having to create them.
In the TICB model, it looks like one of the first tenets is system, which to me is government. And what I've heard, or what I'm going to assume, is that you all really see the stories of people who are impacted by policies which come from government, whether it be local, state, or federal. And so I'm wondering, is there a mechanism, or how do you feed some of that feedback from what you're seeing back to the governing bodies that are, I mean, government creates a lot of these systems in which the trauma can thrive. So if we want some of those systems to stop, we've got to say, hey, you made this policy. This is what I'm hearing in the schools from children and parents. It's not really working. The intentions were well, but it's not working. So I'm feeding back to you some information about the policies.
I can speak, for the model, I would say, in terms of the way it has played out in Potrero, we haven't gotten there yet. Even after 8 years of the intentional strategies, when we think about systems in Potrero, it is government, local government, it also is the schools, it's also, I would say, the network of program and service providers. It's the healthcare system, there's a health clinic right there that the community doesn't generally use. And so it's the interaction with those systems and building in intentional strategies to, sometimes it's educating the systems. Even the word community trauma was not something that was really discussed as part of the HOPE SF model when it was launched in 2008. Now, trauma-informed care, trauma-informed community building as a model, and the understanding of what's happening on the ground is much more widely discussed and understood. Not that the systems know how to respond to them yet, but it is a part of the process.
Yeah, and I would just say from a provider standpoint, one of our main funders for our school-based counseling work is actually through the state of Georgia. And we work with Georgia State University on the evaluation piece, and that's really helpful because we can funnel up the shared experiences amongst providers in Georgia, whether it's rural or urban, and the unique experience of a provider in a particular school or in a school system. So we do regular reporting for them at least once a month on each individual school served, challenges, stories, services that are effective, services that aren't being utilized at all, and then there are all provider events that they bring everybody to. So at least with that particular pot of funding, there really is a big push for strong evaluation because every year the governor's really going to be looking at, is this working, is it effective? I will say it's the 4th year of that particular funding for the school-based counseling services, and we've gotten more money as time has gone on, as we've been able to show our own outcomes. We can't rely heavily on school data for a number of reasons. So we do our own measurements. We use different trauma assessments as indicators, and also strengths and difficulties type of questionnaires where we're really looking at individual student functioning and changes over time. So.
We have 5 minutes left, so the only thing I would like to add is November 6th is coming up. So we all actually have the ability to hopefully make those type of changes. It's not a red issue or a blue issue, but we got to November 6th.
Great stuff. Thank all of you for sharing that. My question is about the model as well. I guess how mature do you feel like the model is? Like how widespread is its use, and are there things that you feel like would help it kind of get out there more that you could use help with? Perfectly
timed. So the model was actually initially developed, I don't know, maybe 6 years ago. The version you have in your hands now just came out a couple months ago. So it is an evolution of the model, and the paper will talk a little bit about the evolution. There are, and the model is a living and breathing model. I think it will evolve over time, and will be sort of implemented differently in different places. It is a model. It is just that, like a model. It's a very simplified version of all of the work, but I think it provides like a framework in how to go into community building in trauma-impacted communities, because that just, in looking at all the literature, it just didn't seem to be out there. The evaluation framework that is a part of it came directly out of funders and people in the field saying, this resonates, this makes sense, but how do we know it's working? And I have heard anecdotally that people really like the framework. It's designed to be interviews, kind of conversations, I would say. We don't want to call them interviews, but qualitative conversations to get at where the community is in terms of the community strengths, to better understand, where they are in that readiness for change. Okay, one more.
Yeah, I just wanted to comment sort of in response to the question about how you measure social-emotional learning and if districts are doing that. I'm a school board member. I'm in Wake County, Raleigh, North Carolina, and we're starting to track things, well, I guess two ways to think about it. One is grit. So when you think about social-emotional learning, that's sort of being behaviors, personality traits. And so what we're looking at is, one, a grit score. And if you just Google grit or grit score, you'll see that there are some studies around grit and how students persist. The thought is that students who try the hardest are the most successful. And so they're looking at ways to measure persistence, which leads to the second, which is also college persistence rates. And so we're measuring the number of students that continue in college from first year to second year. And that's sort of, again, a measure of that personality trait around grit, again, grit, persistence, perseverance, that sort of thing. So it's one way that we're thinking about as a district, how to measure at least how we're impacting social-emotional learning.
I went a bit dark there, so yes, that is the answer. There are, like, from the great state of Texas, Austin ISD is implementing social-emotional learning. There are many districts who are doing great work because of great people like this gentleman who are really being aware of how to track that.
Please join me in thanking this wonderful panel. Yay! So wonderful.